From today onwards, I'm going to talk about pediatrics. Now, pediatrics is a very interesting subject. It deals with diseases and sufferings of children. Okay, so the first class, just like in any other subjects, is history taking and physical examination. Now, you may be wondering why I am starting history taking and physical examination in all of the subjects, because this is one of the most important lecture. Whenever we enter into the clinical phase in that particular subject, okay, or particular field, history taking is the first thing. Otherwise, you don't know how to ask questions uh, to that child or to the parents. If the child is small, then parents act as an informant. So we take history from the parents. And in this class, one special task I'll give to you, and that task is you need to find the difference between adult history taking and pediatric history taking. Okay, and it will be found out later after you go through it. Let's move on. Now, what are the importance of pediatric history taking and physical examination? It is like any other subjects, any other field. Look at the importance of that. Please mute yourself. Look at the importance first. History taking and physical examination is done for the diagnosis of the disease. That's the first thing. That is the first job of us. Another one is to find out the complications of that disease. That can also be found out by history taking as well as physical exam. And if there are some serious illness, then we can predict the prognosis as well. And this knowledge we already have from the theoretical discussion. That's why a doctor has to be good in two components. One is theoretical knowledge, another is practical experience. Then only that person would be a good doctor. See there, all this knowledge you should have before, and that you have from your medical school and continuous ongoing study. But all other, okay, experience you gain from the by visiting hospital, by examining children and things like that. So both are important. Now see here, 60% of the time history and physical examination alone can clinch the diagnosis. This shows the importance. I already talked about this before also. You don't need any investigation. Okay, in 60% of the time only history and physical exam can clinch the diagnosis. In rest of the other 40%, we need the help of investigation. Now, what are the situations where pediatric history and physical examination is done? When the child is ill, definitely. When we are doing health surveillance. Now, health surveillance means the government or that particular health organization wants to know what is happening in that particular area. Okay, for example, what is the average weight of a newborn? Okay, this is one type of health surveillance. What is the average height of the kids in that particular area? That is another example of health surveillance. So for that situation also, examination and history should be taken. And third, because of parental anxiety, the child may not be ill, but sometimes parents are highly anxious. They think their baby is ill. So they quickly bring that child to the hospital, and during that time also, we rule out the disease by taking history and physical exam. Now, let's talk about what is the art of pediatric diagnosis. Okay, this is the first class for you in pediatrics, so please pay attention properly. Now, the art of pediatric diagnosis, see there, we should gather the evidence first. Evidence, and these are gathered by history taking, physical examination, and then investigation. These are the way of collecting the pieces or collecting the evidences. Now, on the other hand, you should have a good knowledge, okay? That is called core information. For example, you think that is a case of pneumonia. You should already know a lot of things about pneumonia. You should know what is pneumonia, what are the clinical features of pneumonia, what investigation you want to order, and how to treat. Then only you can gather the information. So this is called knowledge or core information, which is absolutely necessary. Now, when we combine both these things together, Then we analyze that, what information I got from the patient and what knowledge we have. We do systemic analysis, and then we synthesize the diagnosis. Okay, then we synthesize the diagnosis, and finally we think about what treatment is needed in that patient. That is called therapeutic option. So these are the different points. This is known as art of pediatric diagnosis. It's the same thing actually in any other field. Okay, in any other field, even in internal medicine for the adult side, even in surgery, even in obstetrics and gynecology, orthopedic, any field, this is the same art which we follow. Now, pediatrics is considered a little bit difficult field by the medical students, because sometimes you have to take history from the parents. Not sometimes, I should say many of the time, especially if the child is small, if the child cannot speak, okay, then we have to take history from the parents. So you should have a lot of qualities to be a good pediatrician. So this slide is all about those. Now look at the principles of history taking and physical exam here. This is the art which demand the skill of lawyer, detective, and the judge. This is a difficult job, isn't it? The doctor needs the qualities of all of those, personnel. You should be persistent. If something which you are thinking is not coming from the patient, you should keep on digging it. You should keep on asking the question. Usually the history is learned from the caretaker in pediatrics. Now caretaker, also known as informant, and majority of the cases the informants are parents, either father or the mother. Mother is the first informant, after that father, then grandparents, and sometimes even the relatives, or even the neighbors, or even the friends. So informant can be anyone, but the most important ones are parents. Now exhibit concerns and politeness when you are taking history. Very, very important point. Don't make that child afraid. Okay, don't show rudeness to that parent. Be gracious, gentle, and sympathetic, as well as kind in your approach. This is a very essential qualities of a doctor. Remember, your patient is an honored client for you, so you should relieve anxiety of the parents and instill confidence. They have trusted you, that's why they have brought their kids to you. So it's your job, okay, to relieve the anxiety, whatever they have, and after that you should instill confidence in them so that they will come back again to you if the child is getting sicker next time. Now one very, very important principle: no observation of mother should be ignored, because that child, okay, is under mother's care 24 hours a day, and you have just seen that kid probably for few minutes. So every observation of mother should be assessed, okay, should be inquired, should be taken seriously. It should never be ignored. I'll tell you one important example here. Sometimes what happens, the mother say, doctor, I saw or I noticed my kid was having seizure at home. He was shaking some part of the body, but right now the child was all right. Okay, so probably you don't trust what the mother is saying, but that is not the way. You should trust the mother's observation and ask some important question, and probably, okay, probably admit the child for 24 hours in the hospital. This is the way. Now in the hospital, okay, after you admit the case, after you admit the child, every day you take rounds. So what are the important question you ask in that round? How you write the note of the patients, whether the patient is improving or not, whether the patient's condition is same, whether the patient's condition is deteriorating. So this is called problem oriented chart, and this is known as SWOP format. Okay, listen nicely, this is very, very important information. S means we ask some symptom in the patient, whether they have fever, whether they have joint pain, whether they have headache, vomiting, abdominal pain, burning urination, whatever, that are the symptom. We ask, do you have any problem now? Whatever they say, this is subjective point, so S. After that, you are going to examine the patient. These are objective data, like whether the patient is in coma or not, whether there is rigidity of the neck, whether there is tachycardia, whether there is hypertension, whether there is tachypnea, whatever. Okay, you note that these are called objective data. After that, you analyze it now and do the assessment. After that, you make a provisional diagnosis or assessment. For example, because of this symptom and sign, they have diagnosed meningitis here. A child presents with fever, headache and vomiting, and on examination the child is comatose and have rigid neck. Without any doubt, this is a case of meningitis. Now your examiner or your senior or professor will ask you, what is your plan? Okay, fine, you have made the assessment of meningitis. What's your plan now? And you should be able to tell the plan. That plan means investigation. What investigation you like to do? The first is lumbar puncture and CSF analysis. Probably another one is CBC. Third one is CT scan. So like that, you have to tell the plan. So this is very commonly followed, okay, format. That is called SOAP format, SOAP. Another analysis or another way of, okay, analyzing the patient is flow sheet analysis. Okay, flow sheet analysis. This is not very commonly followed, but this is one way of studying the case. And if some students are following this way, then it is a very good thing for them. You know, they can have a lot of information from the patients systematically. Now see it. If a child presents with fever, now I will ask whether there is cough or not. And if the mother answer there is no cough, okay, the case is very straightforward. Probably, okay, probably this is a common cold, isn't it? Probably this is a case of common cold, or maybe some other viral infections or some other infection. But if cough is present, okay, I will ask about coryza now. Coryza means, anybody know what is coryza?
Sir, coryza is inflammation of mucus layer of the nose.
Very good. Coryza is inflammation of the mucous membrane of the nose, okay, and that child presents as a nasal discharge. Nasal discharge is called coryza. Okay, this is also a type of common cold symptoms. Now see here, fever, cough and coryza, if all of these are present, then I'll ask one more question. Is there any difficulty in breathing or not? And if the mother say yes, probably this is a case of bronchiolitis or even pneumonia. Bronchiolitis or pneumonia. So this is the way we can reach almost to the diagnosis because of the analyzing of the symptom. And if there is no difficulty in breathing, probably this is a case of viral URTI, upper respiratory tract infection, URTI, which is very common in children. Now third way, okay, of presenting your case is a diagrammatic summary. This is also very easy and highly informative one. Now listen carefully, this is quite interesting one. Now today a child came to us with a history of sore throat and fever. Okay, this is called day 0 today, okay, when the illness started. After 2 weeks, the same child presented with puffiness of the face. Puffiness means swelling around the eyelid. Okay, the same child presents with Coca-Cola colored urine. Now Coca-Cola colored urine means the urine is dark red. Okay, dark red.
Sir, bile in urine.
Okay, sorry.
Sir, there is bile in urine, sir.
Okay, actually this is not bile. Okay, remember Coca-Cola means either there is blood in the urine like hematuria, or there is hemoglobin in the urine. So in short form, you know, like this is like a hematuria. Now you may be wondering, the blood should look red, but there is one important point there. If that blood takes a bit of time to come out in the urine, it will look like a cola colored urine. So in other words, this is hematuria. Now oliguria is decreased urination, decreased volume of urine, that is oliguria. So that child after 2 weeks of sore throat and fever develop puffiness of the face or swelling of the face, okay, red colored urine, slightly cola colored urine you can say, and decreased urination, which is oliguria. On the day 20, the same child presents with headache, vomiting, and when we measure the blood pressure, look at the reading here, it is very high, 180 systolic by 110 diastolic, very high blood pressure. On day 30, okay, on day 30, probably the patient was admitted, the patient was treated now. So on day 30 or at 1 month, there is no more edema and blood pressure is falling, still completely not normal. It depends on the age of the patient, but whatever age in pediatric age group, 140/90 is still the high blood pressure. So it is still high, but it is definitely lower than before. And another one, at day 45, the urine is normal, everything is normal, okay, the child is absolutely back to the previous healthy life. Now just analyze this. Can you tell me what may be the diagnosis here? Just analyze. Anybody?
Sir, maybe there is a bacterial infection, pyelonephritis.
Okay, so he is going for pyelonephritis, fine. Okay, that is one of the good answer you have given. Any other? Now let me give you some clues here. Okay, in the beginning this child presented with sore throat and fever. Now after 2 weeks, okay, after 2 weeks, it involved the kidney. It involved the kidney. So this is a highly, okay, a likely case of PSGN, post streptococcal glomerulonephritis. What is the causative agent of post streptococcal glomerulonephritis? Which bacteria? Okay, in pathology we studied this before. Okay,
Pyogenic?
Streptococcus pyogenes. Okay,
Yes, sir.
Streptococcus pyogenes is the causative agent. Streptococcus pyogenes, or another term, group A beta hemolytic streptococci. That is the same organism which causes rheumatic fever. Remember that. The same organism causes post streptococcal glomerulonephritis. So this is a very important information. Now you may be wondering why such a high blood pressure. This is one of the clinical features of kidney involvement. Whenever the glomerulonephritis occurs, blood pressure may be very high, and this headache and vomiting is because of, okay, hypertensive encephalopathy. When blood pressure is very high, that blood pressure can damage our brain. This is called hypertensive encephalopathy. This results in raised ICP, and this can cause headache and vomiting. Now after the treatment, the child came back to the normal. So this is another way of presenting the case. So that's what I was talking about. That, among these three things, okay, the SOAP format is most commonly followed. Please mute yourself. Okay, now after this type of important information, let's move on to the what are the headings of pediatric history taking. So all of you please focus on your screen now. See there. Now let me go through the headings and tell you the difference. General information of the patient, same, just like any other field. There is no difference at all. Chief complaint, same. History of present illness, same. This is a very important part of the history. And there is one big heading which is absolutely different in pediatric. We do not take any antenatal history, any birth history, or any neonatal history in the adult. Okay, we don't need to take. We ask developmental history in pediatrics. We ask immunization history all the time, and we ask nutritional history, which are not necessary in other field of the medicine, like in adult side. Nothing like that we ask in surgery, nothing in obstetrics, and nothing in internal medicine. Okay, some of them may be necessary looking at the case, okay, but these are highly, okay, specific in the pediatric field. So let me go through them again. This is called past medical history, and we ask antenatal, which is called prenatal history. That means before the birth, when the baby is still developing inside the uterus. Okay, some important question has to be asked to the mother. Birth history, okay, we'll talk about each of them later on. Birth history, we ask in detail, and after the birth, till 1 month of life, we take the history. This is called neonatal history. Now, developmental history, we ask all the time. Now, there is a difference between growth and development. Now, development is acquisition of skill, okay, gaining of skill. Okay, development of skill is known as development. For example, at the time of birth, a baby even cannot raise the head. Okay, forget about walking, forget about turning on the side, okay, forget about catching something, cannot do anything. But slowly, when the baby becomes bigger, the baby will turn on the side, the baby will catch something, the baby will start to speak, and the baby will start to walk. This is called development. Never forget it. Later on, I'll have a class about it. Immunization means vaccination. We all the time ask this question. And nutritional, what type of food the child is eating. Many of the cases our kids in our part of the world are malnourished. So nutritional history is very, very important. Now other history are same. History of past illness, family history, and social history. They are the same one. Now those things which we have already done before, just like any other field, okay, I'll go a little bit faster and will mainly focus on the pediatric component. Now pay attention. This is the basic information which is always asked in the beginning. Who is the informant? Now informant means the person who has brought the kid to the hospital, that is informant. Especially if the kid cannot speak, especially if the kid is small, we ask all the question to the informant. Okay, so the best informant is the parents, especially the mother. If mother is not there, then father. If father is not there, then grandparents. Okay, then it will go on. And sometimes if the child is sick at school, maybe school teacher can bring the child to us. So they can also be the informant. Name, age, and sex are always asked. Ask about the parent's name, age, sex, address, phone number, income, occupation, education, and religion. Okay, no need of any explanation. These questions are always asked. And one more thing, assess the reliability of the informant. Now, what do you mean by that? Reliability means, okay, how correctly the information is coming to you. If informant are parents, this is highly reliable. Okay, but if the informant is a neighbor, if the informant is a school teacher, sometimes the correct information is not coming. So reliability also should be assessed. Now the second important heading is the presenting a chief complaint. Now see, there so many times we have discussed this. Okay, in surgery also we talked about, in other field also. So what is the chief complaint? Chief complaint means what is the problem, and because of that problem the child was brought to the hospital. Okay, this is called chief complaint. Sometimes the chief complaint can be only one, sometimes it can be many. So if there are many, You have to record them in a chronological order. Okay, we already talked about this, and there is a good example here. Please go through it. Runny nose for 5 days, cough for 3 days, vomiting for 2 days, convulsion for 1 day, and loss of consciousness for 12 hours. Nobody will give you information like this. Okay, it is just I am collecting this piece of information just to make you understand what do you mean by chronological order. Now see here, the symptom which is there for the longest duration, that is 5 days, is told first, and the symptom which is having the shortest duration, 12 hours, has to be told at the end. So this is called chronological order. Do not mix them up. History of present illness. Okay, this is elaboration of the chief complaint. Now we should ask individual chief complaint in detail. One very important way of starting this is the child was apparently well until some duration, maybe 1 week, 10 days, maybe 2 days, or maybe few hours. So that can be anything. It depends on the chief complaint. Another important skill you should learn in history of present illness is do not ask any leading question. Okay, do not ask leading question. Leading question means those question which gives answer in yes or no. These are leading question. So these are discouraged. Rather than that, we should ask question in open way, like how, what, and why, so that more information will come from the parents. Now let us take one example here. If I ask to the parents, is there fever or not? Okay, the answer is either yes or no. But if I ask, okay, what happened to your kid? Can you explain to me? If you ask that question, then the parents will give you in detail, version or detailed history, isn't it? So this is always better way of taking history. But sometimes what happens, the parents will misguide you. They will tell whole story which are not necessary also. And if they are diverting from the main path, then quickly you can ask some leading question to pull them back to the track. So leading questions are also important during this regard. Now, what are the other parts of history of present illness? See there, the course of the disease, the severity of the illness, the complications of the illness, and details of the treatment already received must be recorded in all cases. Now, what do you mean by course of the disease? Anyone? What is course of the disease?
Sir, it's related to the
How long,
pattern
how
and
how
duration
disease is
disease
progressing.
occurs.
It is duration of the disease.
Okay, so many answer I'm getting, very good. Okay, all of you are almost there. The course of the disease means how it started, are the symptoms now, okay, over few days. For example, if the parents say my child was sick for 1 week, so you should ask how was the child in the beginning when the illness started. What happened after that? After 1 day, after 2 days, after 3 days, what happened? Was the illness same, or was the illness increased than before, or it's getting better? So this is called course of the disease. Now severity, whether the child is getting more sicker or not, that is severity. Complications, okay, this you already know, these are listed later on actually. Okay, when you are presenting the case to your examiner or to your professor or to your senior, that time they will ask you what complication you notice in the disease, then you can list after that. And if they have visited some other clinic or some other hospital, then what treatment they took, okay, what are the antibiotic given, for how many days, what are the other treatment, everything has to be recorded. This is such an important point. Now, whether the disease localized to body system or generalized, Now this information we get from systemic review and symptom review. Now if you remember, we already talked about this before. Systemic review means 1 or 2 questions I have to ask from each and every system. From central nervous system, 1 or 2 to 3 questions you quickly ask, like headache, vomiting, seizure, loss of consciousness. If nothing's are there, probably central nervous system is not affected. From respiratory system, you can ask cough, difficulty in breathing, chest pain, noisy breathing. Okay, if they are present, probably the disease is like located in the respiratory system, like pneumonia, like bronchiolitis, like bronchial asthma, like bronchiectasis, like pulmonary tuberculosis. If they are not present, probably disease is not there, it is somewhere else. So this is the way we take systemic review. And during that time, negative history is also important. Like for example, if the parent saying there is cough, okay, there is cough, but I should ask about history of fever at the same time, and chest pain and sputum production, but she says those histories are absent. These are called important negative history because they belong to the same systematic review. Okay, now another one, sometimes some close inquiries are also necessary for clarification. Okay, usually we ask open inquiries, but sometimes close inquiries are necessary if they are deviating from the main history. If they are telling their own story, we don't want to listen that, we don't have enough time to go through that. So just to pull them back to the mainstream, you can ask some close inquiries like who, when, and where. It depends on the situation. Now the important part I am reaching, so it will take a bit of time. Okay, so today's the first class is all about this history taking. Now see there, past medical history. So there are few components of past medical history. The first component is birth history. Okay, the first component is birth history. Now birth history is again divided into 3 different headings. Okay, birth history is divided into 3 important headings. That is prenatal, or antenatal is the first one. Then the proper birth history is called natal history. Natal means birth history. And then postnatal, what happened to the kid immediately after birth. So these are parts of the birth history itself. Now what are the information we take in prenatal history? Now see there. Okay, we ask about maternal illness. Okay, was the mother absolutely healthy during pregnancy, or did she suffer from some illness? Now 1 or 2 example immediately. If she had fever during pregnancy, if mother suffers from fever during pregnancy, especially the first trimester, and along with fever, if rashes are also there, this can be a case of rubella. Okay, this can be a case of chickenpox. And if those diseases are missed, then the baby may suffer from congenital rubella syndrome, or probably congenital varicella syndrome as well. Any type of maternal illness should be recorded. Now any drug during pregnancy has to be recorded, especially during first trimester. Now why I am giving a lot of emphasis to the first trimester here? What is happening in first trimester?
Organogenesis.
Organogenesis. Development of the organs.
Very good, excellent. Embryogenesis or organogenesis occur in first trimester. Okay, and if that pregnant lady took some drugs, and if those drugs were teratogenic, it will be a major problem. So ask about each of the drugs she took. And later on, it's your job to decide whether they are teratogenic or not, but the information should be collected. Ask about bleeding in the pregnancy and toxemia. Now toxemia is hypertension during pregnancy. hypertension, also known as PIH, pregnancy-induced hypertension, and any type of bleeding during pregnancy has to be recorded. Now, there are so many causes of bleeding during pregnancy. We have studied this in obstetrics. Okay, abortion can lead to bleeding during pregnancy. Ectopic pregnancy can lead to bleeding. Molar pregnancy can lead to bleeding. Okay, even antepartum hemorrhage can lead to bleeding. These are the major causes. Asks about whether there is exposure to X-ray or not. Now, X-ray exposure during first trimester can be teratogenic to the developing baby. Okay. Asks about the duration of pregnancy. How long? What is the duration of pregnancy? Till now, when the lady comes to you to the hospital, that time you have to ask about the duration. And for example, the baby is already born. Now you are looking after that baby. You are examining that baby. You are taking history from that baby. Asks about, okay, what was the duration of pregnancy regarding this baby? Was it preterm, full term, or post term? How many weeks? Like that, the question should be asked. Now, what is the normal duration of pregnancy? Okay, what is the normal
38
duration?
weeks to 42 weeks, sir. 38 weeks to 42 weeks, sir.
38
38
to
to
42
42.
weeks.
Very good, very good. You can also call it 37 completed week till the 42 week. Okay, 37 completed week till the 42 week. This is the normal duration of the pregnancy. Never forget this. Another question, any discharge per vagina, that is premature rupture of membrane, did that happen during pregnancy or not? That question is very relevant because it may be associated with infection in the baby after the birth. Now after this, let's go to the birth history. What is the total duration of labor? We ask that question. What is the type of delivery? We ask that question. Which anesthetics are used? Okay, I'll elaborate this again after the break. Where the baby is born, home, hospital, or on the journey itself, and how umbilical cord was cut. We start our discussion. I was talking about birth history, means the proper birth history. So we should always take a history of the total duration of labor, okay, whether it is more than 18 hours or more than 24 hours or not, that is considered prolonged labor. More important than that is type of delivery, okay, like cephalic, which is considered the normal one. Breech delivery, it's an abnormal type of presentation. Cephalic means head is coming out first, and breech means the lower part of the body comes out first, like buttock or lower limbs. Instrumental delivery, there are two types, forceps and vacuum. They are called instrumental delivery. Sometimes the mother is too tired to push the baby, so we must take the help of instrument, that is forceps or vacuum. In obstetrics, you will learn that. And cesarean section is the operation or surgery which needs to be done sometimes to take the baby out. So what type of delivery? You should take that history. Whether some anesthetic was used or not during delivery. Usually we don't go for any anesthetic, but sometimes, okay, sometimes during cesarean section some anesthetic need to be used. It depends on the situation or indication. Now anesthesia used during labor or delivery can lead to central nervous system depression in the baby. That's why that question is important one. Okay, now another question, where the baby was born, in the hospital or at home or on the way. Sometimes what happens, inside the car or inside the ambulance or inside the taxi, the baby is delivered. So that also should be noted. And how the umbilical cord was cut. If the baby was delivered in the hospital, no need to ask this question. But if the baby was delivered at home or on the journey, this question is highly relevant. Okay, let me ask you one question here. What happens if umbilical cord was cut with some unsterilized instrument? Yes,
The bacteremia.
Chances of infection.
Chances of opportunistic infection increases.
Okay, many of the students are taking the name of infection. Very good. Okay, that is the answer. Any infection can occur, but we are mainly bothered about neonatal tetanus. Neonatal tetanus can happen if some unsterilized, sharp instruments may be used for the cutting. But nevertheless, any other type of infection can also occur. Now, after the birth of the baby, okay, we should ask about neonatal or postnatal history, whether the baby was full term or preterm delivery. Now, every student know the meaning. Full term, 37 completed weeks. After that, if the baby is born, full term delivery. Preterm, before 37 weeks of gestation. Ask about the birth weight. Okay, this is a very important point if the baby is born at hospital, because mother know or the parents know about the birth weight of the baby. It is one of the important information for them. They always want to know the birth weight of their baby. Okay, so ask about that. But what if the baby is delivered at home? Okay, there is no weighing machine at home. Okay, so there is one other way of asking the question. We cannot exactly know what is the birth weight if the baby is delivered at home, but we can ask, how big was the baby? Was the baby looking very small? Was the baby average, just like any other baby? Or the baby looks big at the time of birth? So this is the indirect way of asking question related to the birth weight. Now, another important point there you can see is Apgar score. Okay. Now let me talk about that Apgar score here. Okay. Now see that. Let me analyze this Apgar score nicely. Okay. There is no hurry for you. Now Apgar score is calculated 1 minute and 5 minutes after the birth. 1 minute and 5 minutes after the birth. So these are the two time when we take the Apgar score. Now there are 5 important points in Apgar score, which is denoted by APGAR. Now A stands for appearance. A stands for appearance of the baby, whether the baby looks bluish, whether the baby looks pink, or whether the baby looks pale. Okay, pink is normal, pale and bluish abnormal. This is appearance. Now P stands for pulse, but in the newborn we don't take the pulse, so this is heart rate. Okay, this is heart rate. Now see here, heart rate. Okay, after that G stands for grimace. Now grimace means if I put a catheter, okay, inside the nose or inside the mouth, especially in the nose, the baby will show some some expression on the face. This is called grimace. Sometimes the baby may sneeze also, so that is very strong type of grimace. After G, it's A, that is activity. Okay, activity means movement of the limbs, and the R is respiration. Okay, respiration. So this is called Apgar score. So this is very, very important point. Later on I'll take a class about it. Just now you know the meaning of this. Okay, and the maximum Apgar score at the time of 1 minute and 5 minutes, the maximum Apgar score can be 10. Okay, and the minimum Apgar score is 0. If the Apgar score is 0, that means it's a dead baby. Okay, 10 is the highest one. Another question I like to ask is, resuscitation required at birth or not? Now, what do you mean by resuscitation? What is resuscitation? Anyone?
Supplying
Supply of oxygen.
Physiological disorder, sir, in a ill patient.
Okay. Now, resuscitation, okay, some of the students have already answered. Resuscitation is any help the baby need from our side at the time of birth. That help is, if the baby was not breathing properly, we have to give oxygen. If the baby has a lot of froth, we need to apply suction there. Sometimes the baby is not breathing at all. During that time, we need to give bagging to the baby. It is done by umbu bagging. And sometimes the heart is not functioning well. We need to give chest compression or even the medicine. This is resuscitation. If the baby needs any help from the doctor's side or from the nurse's side regarding the life or maintenance of the life, this is called resuscitation. So we should always ask that question. Any respiratory problem, we should ask. Any cyanosis there or not after the birth, we should ask that. Cyanosis means bluish discoloration, okay? Bluish discoloration of the skin and mucous membrane when reduced hemoglobin is more than 5 gram%. This is cyanosis, okay? Reduced hemoglobin should be more than 5 gram per deciliter. Ask about jaundice, okay? And these are the two common causes of jaundice: RH incompatibility and ABO incompatibility. Now, RH incompatibility means mother is, okay, a negative blood group and father is positive blood group. That means baby has high chance of positive blood group. So this is RH incompatibility. Let me give you one example here. For example, mother is A negative, okay, but baby is B positive, for example. So this is clear-cut case of RH incompatibility. ABO incompatibility means mother is O blood group and baby is either A, B or AB. Now this is also not matching. So this is ABO incompatibility. There is high chance of hemolysis and then jaundice. These all are special topics, okay? We'll talk about them later. Just know the meaning now. Whether the baby needed any incubator or not after the birth. Incubator is mainly, needed by preterm babies who are very small or who are premature. Oxygen therapy, how long it was given after the birth? We asked that question. Any congenital anomaly at the time of birth? We asked that question. So many babies are born with congenital anomaly like spina bifida, like anencephaly, okay, like gastroschisis, like omphalocele, okay, like congenital heart disease, which may not be discovered immediately at the time of birth. It may take a bit of time to diagnose it later, okay? So these are the examples. And at what age or at what day the baby was discharged from the hospital, we should always ask. If the mother say they did not discharge the baby quickly, the baby was discharged after 1 week or 10 days or 2 weeks, that means something was wrong. Probably the baby was not fine, okay? So these are the important information. Now, after 3 components of the birth history, let's move on to the another component of past medical history, which is feeding or nutritional history. Okay, now let's pay attention here. Now, how long the baby was breastfed? Very important question. How long? The normal duration for breastfeeding is 6 months. Okay, only breastfeeding, which is known as exclusive breastfeeding. It has to be done for 6 months. If the baby was bottle fed, okay, what type of milk was given? What was the dilution? What was the amount? How frequently in a day? And what is the feeding schedule? Every question has to be asked. Now, from the pediatrics point of view, okay, being a pediatrician myself, we never encourage a bottle feeding in a child or in a baby. We always encourage breastfeeding, because bottle feeding is not that good. It may be associated with so many illness in the baby, especially if the parents do not know how to clean that bottle. They do not know how to prepare the milk, and so many things are there. So every question is important here. Now, what is weaning? Anyone? What is weaning? Have you heard this term before? Okay, so probably you don't know that. So weaning means after exclusive breastfeeding, what is the first feed or food the baby received? What is the age of that extra feeding for the baby? This is called weaning. any extra feeding or extra food you give to the baby is called weaning. So the appropriate time for weaning is definitely 6 months according to World Health Organization. Okay, but sometimes many family they cannot wait till 6 months. So these days even 4 months can be considered fine, but before 4 months absolutely not. No extra food should be given before 4 months. Now if extra food was given, what was the nature and amount of that solid food? Okay, so you need to ask the question. Now if the baby was like for example the baby is ill now, that's why the parents brought the baby to the hospital. What was the diet the child took just before illness, and what type of diet they are giving right now? This question is asked. This is important. Let me tell you one important point here. During illness we should give more nutritious diet to the baby, because there is increased basal metabolic rate. The baby is burning more calorie or energy. During that time some energy rich or energy dense food should be given to the baby. Ask in detail about the food intake in last 24 hours and what is the approximate calorie and protein intake per day. So feeding history is a challenging one. It is not very easy to calculate this calorie, okay? But especially if the child looks malnourished, then our professor or examiner want to know about the feeding history in detail. Now after feeding history, okay, after feeding history, it is the time for developmental history. Now development, let me repeat again, development means, okay, gain of skill. The baby is gaining different skill in the life. When the baby grows older, different types of new skills are learned, okay, and this is because of development of central nervous system. So this overall concept is called development. Now you should ask certain questions here, and that questions would be, do you believe this baby has learned all the skill just like your other babies? This is a very important way of asking. And if the mother thinks, yes, I don't feel any difference, this baby is absolutely all right in my eyes, other babies were also like him or her, absolutely fine, there's no problem. But if the mother have noticed something, mother says, he is a bit slow to walk, okay, he is slow to speak or something like that, slow to eat, anything like that. If the mother has noticed something, then some detailed history has to be taken. Now assess in all fields of the development. Now, there are 4 fields of the development, okay. This is a special class, later on I'll talk about it, but right now just know the name of those 4 fields. One is called gross motor, second fine motor, third personal and social, and the fourth one is the language. These are the 4 fields of the development in a baby. So gross motor, fine motor, personal and social, and the language. In detail we'll talk later. Now identify whether there is global retardation or retardation in a specific field. Now global means all those 4 fields which I just told you are retarded, okay, all 4 fields global retardation, and only a specific field, that is a specific retardation in that particular field. So we need to find out. Now few examples given here. If there is delayed speech, if the baby is unable to speak in time, now the most common cause for that may be deaf mutism. Now deaf mutism means the baby cannot listen or cannot hear, and once the baby cannot hear, the baby will not learn to speak. This is a very important point. Okay. For example, inside the family, we are talking all the time, we are teaching our babies, but if that baby is not listening anything, the baby will not learn to speak. This is called deaf mutism. If the baby has delayed motor skill, that is gross motor, the baby is not walking, okay, then it may be a case of protein energy malnutrition or PEM, or It may be a case of hip dislocation. That's why the baby could not walk. So this is called specific retardation in that field. After development, you ask about immunization history. Now, immunization itself is a big class, okay, in pediatrics, very important class. So I'll definitely take this later. Right now, you just know how to take the history. Just ask one question, okay. Till now, are all vaccines completed in your baby or not? This is a very standard way of asking question. Till now, are all the vaccines completed in your baby or not? If the mother say yes, confidently, we go with her. If there is a doubt, you ask for the record card, okay. Parents usually have record card of the vaccination. You quickly check what type of vaccines the baby has got. Now, after completing the past medical history, which is special only in pediatrics, now other histories are a bit similar to other variety or other medical speciality, like in internal medicine or surgery or in other field, like history of past illness. So ask about hospitalization or any major illnesses in the past, okay, and if there are any, list in order with date, okay, name, diagnosis done by the doctor, and location of the hospital, if any. If none, it is very easy. Any surgery done in the past, take a record. Any major trauma in the past, like any fracture, any head injury, any other trauma, you should note it. And any history of drug allergy in the past or any other type of allergy, like food allergy, like hay fever or even asthma, these are also allergic disease, you should have a note. So these are called history of past illness. One important point I like to highlight, past medical history and history of past illness are not same in pediatric age group. This is very, very different one. Now, family history, okay, it is similar to other specialty as well. Have a look there. Asks about the health of mother and father, asks about their age, okay, and asks about the history of consanguinity, if it is there or not. Now, what is consanguinity? Anyone? Anybody? Anybody can answer this question? What is consanguinity? Okay, now I have unmuted yourself, so you can answer. Anybody? What is consanguinity? Sorry, I have done the opposite thing actually. Okay. Now, probably you don't know the meaning of this thing, so let me explain.
The same ancestors are mainly. This is what I got, sir. The same ancestors mainly.
Okay.
Same descendant, same facts that come for descendants.
Okay. Yes, you are right. Okay. So let me explain this in other way. Consanguinity means if there is a marriage between very close relative, especially the first degree relative, okay, or very close relative, then there is a high chance of autosomal recessive disorder. That is the danger. So let me write that point for you here. Okay, autosomal recessive disorder. So we should take that history, especially if it runs in the family, then there is a high risk. Some of the example of autosomal recessive disorder would be thalassemia, sickle cell anemia. Okay, these are the important example which are very common in South Asia. Asks about mother's pregnancy. If there are many babies, list them in chronological order with duration and outcome of each of them. Important history. Asks about the history of tuberculosis, diabetes, any allergies which runs in the family. Asks about any bleeding disorders which are present in the family or not. Any history of rheumatic fever or any heart disease, any peripheral vascular disease, any kidney disease or liver disease, and any central nervous system disease leading to convulsion. Okay, note that. And any congenital malformation which runs in the family should also be noted. So let me summarize this family history. Ask in detail about every family member. What is their health? Is there any disease running in the family or not? And you will get all the information. Now we have come towards the end of this history taking. After that, we move on to the physical examination. One more is social history. Okay, see here. Asks about the education, occupation, or income of the parents. This is a part of the social history. And if education and occupation or income is good enough, then the social conflict will be very less inside the family. Okay, familial conflict will be less. This is a nice, harmonious environment in the family. If mother is working, who looks after the child at home? Very, very important question. These days, many mother, they work outside, especially if the baby is small. Who looks after that baby when the mother is not at home? Is it father? Is it grandparents or somebody else? Okay, so probably the care may not be enough if other people are looking after the baby. So important question. Asks about the situation or the condition of house. How many number of rooms? What about air ventilation? What about sewage disposal? What about water source? These are very, very important information in case of some contagious illnesses like typhoid fever, like viral hepatitis. These are important questions. Or in case of respiratory illness, the air ventilation is very important question. Asks about some harmful social and cultural practices which the family was practicing. Like if a baby is very irritable, if the baby is crying most of the time, who knows? They may be giving dummy nipple or pacifier to the baby. Okay, sometimes we do that, but all the time this is not a good practice. Okay, because it may introduce some infection to the baby, or the baby may be used to that artificial or dummy nipple, which may not be good for the natural type of breastfeeding. Asks about school performance. If the child is going to school, what about school performance? What was school performance 1 year ago? Is it same again, or is it deteriorating, or is it improving? This is a very important information. And last but not the least, asks about any smokers in family, asks about any pet in the family, or any other environmental concern. Okay, important are smoker and pet. The parents or the grandparent, they should not smoke in front of the small babies. That is very, very harmful for the respiratory tract. That smoking is damaging the cilia, so that easily respiratory tract infection can happen to the baby. Now, pets, this is a very controversial statement. Many of the family, they love to have pets at home, like dogs, cats, and those things. But remember, if your baby is having allergy, okay, then you should be really careful keeping those pets. Now, after doing the history taking, okay, I'm sure you have already got the enough information. Let's talk about how to start examining the child. Okay, what are the principles and art of examination of the children? Now, first of all, we should gather some essential tools. What instrument we need? Okay, what are the things we need to examine the child? And second, what is the setting? What type of setting we need in our clinic or in the hospital? Okay, now these are the essential tools. So please have a look there. So stethoscope is one of the most important instrument a doctor or medical student should have, and this stethoscope preferably a pediatric stethoscope. Okay, preferably a pediatric one. But for a medical student, we don't ask you to buy a pediatric stethoscope. Okay, whatever stethoscope you have, that will do the job. Torch is very important. Tongue spatula is important to examine the throat. Thermometer, percussion hammer, also known as knee hammer, to elicit the tendon jerk. Fiberglass tape measure, this is a measuring tape, absolutely necessary in pediatric examination. Sphygmomanometer to record the blood pressure, and this sphygmomanometer should be of different sizes. Remember that pediatric age group starts from the time of birth till 16 years of age. From the time of birth till 16 years of age. So a neonate needs a very small sphygmomanometer. A toddler, okay, a little bit bigger than that. So like that, when the age keep on increasing, the sphygmomanometer size also increases. For the assessment of development, we need developmental assessment tools. Weighing machine is very necessary, and a wall chart for the measurement of height has to be there in the clinic. Otherwise, you don't know how to take the height. So these are very essential tools. Now, what type of setting we need? Okay, see here. Well lighted, warm and colorful room, which should be comfortable, and the examiner's hands should be warm, especially during winter. These are very essential point. The child should enjoy that environment. That's the bottom line. Okay, child should not scare of that setting. Child should enjoy. Child should want to stay there a bit longer. That type of environment is preferred. Different types of toys, pictures, and cartoons should be kept in the room, so the baby would be a little bit distracted, and during that time you can quickly examine the baby. So these are very essential. And avoid some deep yellow or blue curtains, and because these will disturb us when we examine jaundice and cyanosis. Jaundice and cyanosis has to be examined in natural sunlight, especially jaundice. We take that baby near to the window, okay, and examine jaundice in the natural sunlight. Otherwise, sometimes it may be mistaken. So these are some of the important points. Now see here, what should be the approach of a pediatrician? In the beginning of the class, I already explained this point. The pediatrician should be gentle, should be confident in himself or herself, should show sympathy to the kid, should be patient enough. Sometimes the kid is crying all the time. So you should not be irritable. Okay, you should not show that face, that irritable face to the parents. You should be patient enough. Okay, you should show concern. Okay, if the child is having pain, show concern and show sympathy to the parents. Have a kind look and show love for the kid. These are very essential qualities of a good pediatrician. Okay, so the baby loves you. Okay, even for the second or third time or the later on, when something wrong happens to the baby, the parents will bring that baby to you. So this is good, okay, for your business as well. Now, what are the positions for examination? This is another important point during examination. See here, from birth till 3 months, we should examine the baby on examination table. Just keep the baby on the examination table and quickly examine. From 3 months to 1 year, mother's lap is the best, because this baby will be a little bit afraid of the stranger. From 1 to 3 years, standing or mother's lap. Mother's lap is better, but if the baby is standing, the parents should be there very near to the baby. After 3 years, examination table again. And very important point, probably I've explained this point earlier to you. If she is an adolescent girl, if the patient is the adolescent girl, a female attendant or the nurse should be present at the time of examination. Never forget this. Don't close the door and don't examine that adolescent girl without female attendant or the nurse. Okay, this is against the medical ethics. Same thing we do in obstetrical examination also. Now, how we start examining a child? Okay, The first thing is observation. So see there are different points in observation. What is the posture of the child? What is the expression and mental state of the child? And are there any abnormal movements, okay, or not? So these are few of the information. Okay, so there's so many other things, but only the important things are highlighted here. So regarding the posture, some of the example, okay, whether the baby is bedridden, whether the baby is having opisthotonous position, whether the baby is lying on the side posture, or is there any orthopnea or not, whether the baby is motionless, restless, or very comfortable on the table or on the bed. These are called posture. Now bedridden means very sick child, a sick baby, okay, probably terminally ill baby. One of the good example I can give is terminal case of the cancer. Now, what is opisthotonous position?
Sir, is due to the muscular spasm of paravertebral muscle spasm due to Clostridium infection in tetani.
Okay, very good, very good. Though there is a little bit, internet problem, but I still listen what you said.
Spasm of
Yes?
muscles of the neck and hand.
Spinal column to be simple, sir.
Okay, so the students are answering this is excessive muscle spasm, mainly on the extensor side of our body, mainly on the back side. Okay, extensive muscle spasm or contraction on the posterior aspect or on the back side of the body, and this is mainly seen in tetanus. Okay, this is mainly seen in tetanus. Okay, tetanus, opisthotonous position. Now side posture is mainly seen in pleural effusion or pneumothorax. For example, if pleural effusion is present on the left side, the baby will lie on that side. That means on the left side. If it is on the right side, the baby will lie on the right side. Because if the baby lie on the other side, then there will be mediastinal shift because of the movement of the fluid, and other lung can also be collapsed. Okay, so side posture mainly seen in pneumothorax or pleural effusion. Orthopnea, every student know that orthopnea is seen in heart failure. It is a feature of pulmonary edema. So whether the baby is having orthopnea or not, we have to closely observe. And orthopnea means difficulty to breathe in flat position or in flatly supine position, isn't it? So to relieve from orthopnea, probably there is more than one pillow used, or probably the head end of the bed is raised. So this is the treatment of orthopnea along with some medicine. Motionless is seen in peritonitis. If there is peritonitis, the baby will not move, okay, because movement will cause more pain. So the baby doesn't move. The baby will be coiled up on the bed. Restless is seen in musculoskeletal pain somewhere in the body. For example, osteomyelitis, okay, the baby will be very restless. Septic arthritis, any fracture, any pain, the baby will be restless. And comfortable means probably the baby is not very sick. So these are very important points. Now observe the expression and mental state, whether the baby is fully conscious, drowsy, semi-comatose, or coma. This is judged by Glasgow Coma Scale or ABPU scale. In my next class, I'll talk in detail about them. Observe the abnormal movements, okay, and this, regarding the sequence of examination, we should be opportunistic. Auscultation should be done first, followed by other. Now, if the child is fully conscious, okay, or drowsy, or semi-comatose, or coma, we have to mention that during the examination. And how we know that whether the child or baby is in coma or not, okay? Other things are a bit easier, but coma, the grading of coma, or how severe is the coma, It is mainly done by Glasgow Coma scale and ABPU scale. So let me write that for you here. Okay, Glasgow Coma scale, also known as GCS, Glasgow Coma scale, or AVPU scale. Now, see here, Glasgow Coma scale or AVPU scale. Now, what do you mean by this? Glasgow Coma scale comprises of three things: opening of eye or eye opening, verbal response, also known as V, and motor response, also known as M. So EMV, E is eye opening, V verbal response, M for motor response. In detail, we'll talk somewhere else. And ABPU, A means alert, okay, alert, V responsive to voice, P responsive to pain, and U is unresponsive. So these are some of the important points in Glasgow Coma scale or ABPU scale. Examine for abnormal movements, signs of meningeal irritation, any peculiar order or nature of the cry. These are also very important point. Now, abnormal movements, so the examples are seizure disorder, okay, like seizure disorder, then we can consider some chorea, tics, those type of movements. If any, we need to note. Three important signs of meningeal irritation, probably you have studied before, are neck stiffness, Kernig sign, and Brudzinski sign. Neck stiffness, Kernig sign, and Brudzinski sign. These are called signs of meningeal irritation, which are present in meningitis or meningoencephalitis. Whether there is peculiar smell or odor coming from the child or not, one of the important example I like to highlight here is phenylketonuria. Phenylketonuria is a name of a disease, amino acid metabolism disorder, okay, where there is a very peculiar odor from the body. And nature of the cry, in case of meningitis, the child has a very shrill cry, okay, means very loud tone type of cry. Okay. So these are some of the important observation finding. Now, before the break also I highlighted this point, we should be opportunistic in the sequence of examination of a baby, okay, because the baby can cry anytime, so auscultation is done in the beginning or in the first, especially in respiratory or cardiovascular problem. Auscultation is very important examination, so it has to be done when the baby is quiet. Now here, another important examination is built-in nutrition. Now that is known by skeletal size, okay, examination of body frame or just simply observing it, measurement of subcutaneous fat, muscle mass, all these things should be assessed. So these are again done by taking height and weight, okay, taking height and weight, measuring the subcutaneous fat and the muscle mass. At the same time, we need to look for the evidence of protein energy malnutrition. This is kwashiorkor or marasmus. At the same time, there are different features of vitamin abnormality as well. Another important part of physical examinations are vital signs measurement. Now let's see the name of the vital signs here: temperature, pulse, respiration, blood pressure, and pulse oximetry. Okay, temperature, pulse, respiration, blood pressure, and pulse oximetry. Temperature, if the child is febrile, we should always measure the temperature. There's no doubt about it. And there are different sites where we can measure the temperature. Oral root is one of them, axillary root is another one, fold of the groin is another one. But in a very small baby, okay, we don't put the thermometer into the mouth because it may be hazardous or dangerous. Usually axillary or groin temperature is measured. These days some electronic thermometers are already there, just showing on the body, any part of the body, and it will measure the temperature. You have already noticed that, isn't it? These days the pandemic of COVID-19 is going on all over the world. So wherever you go, They quickly, measure the temperature, whether you are febrile or not. The same type of instrument may be available in the ward and the hospital also. Pulse and respiration, okay, we always examine. We'll talk about that in some appropriate time later on, how to do that. Blood pressure, appropriate size of the cuff is necessary, and blood pressure should be measured in all 4 limbs if congenital cardiac lesion is suspected, especially one type of congenital cardiac lesion. What is that? Anybody? In that situation, I want to take blood pressure of the lower limb. Which is that? Congenital cardiac disease. Who can answer that? No one? Okay. So the answer is coarctation of aorta. Coarctation of aorta, because in coarctation of the aorta, the blood pressure in the upper limb is more than the lower limbs. And until and unless I measure blood pressure in the lower limb, I cannot confirm it. So COA, or coarctation of the aorta. Pulse oximetry is considered the 5th vital sign these days, and this pulse oximetry is always taken, especially if the baby or the child presents with difficulty to breathe. If you think there may be a feature of hypoxia, just go for it. And normally the pulse oximeter or the oxygen saturation, okay, pulse oximetry reading I should say, or the oxygen saturation should be more than 95% in room air. That is considered normal. Now see there, this is anthropometric measurements, height or length, weight in percentile, mid-arm circumference and head circumference. I'm taking another class which is called assessment of the growth immediately after this class. So in that class we'll talk everything regarding this, how to take height, how to take length, okay, how to take weight in a child, what do you mean by percentile chart, everything. Measure chest circumference also at the level of xiphoid process and at mid respiration, and measure the upper segment and lower segment ratio as well. Now what do you mean by that? Take the total height first, okay, take the total height and then take the lower segment from the pubic symphysis to the heel is the lower segment. Then upper segment is very easy to calculate, then take the ratio. This is the way. Okay, in our next class we'll talk about this in detail. Now another part of physical exam would be examination of skin and skin appendages, like what is the color of the skin? Is it jaundice? Is there pallor, or is there cyanosis, or is the baby pink in color? Pink color or slightly red in color is considered normal. Jaundice, okay, or icterus, this is suggestive of so many different disorders like liver diseases. Pallor or anemia, and cyanosis or bluish discoloration. Examine for clubbing, whether it is there or not. Examine for koilonychia. Now in which situation koilonychia is seen?
Iron deficiency.
Hypochromic anemia.
Okay, very good answer. Hypochromic anemia.
Sir, iron deficiency anemia.
Very good. Or to be very precise, you can directly say iron deficiency anemia. In iron deficiency anemia, koilonychia or spoon-shaped nails are seen. Splinter hemorrhage occurs in infective endocarditis. Infective endocarditis. Osler node, also in infective endocarditis. Rashes, so many different conditions. Viral infection, bleeding disorders, so many. Skin turgor, okay. Skin turgor is reduced in case of dehydration. Skin turgor means elasticity of the skin. This is reduced in dehydration. Texture, how smooth is the skin? We have to feel it. Nevi, in so many children or so many people, nevi are considered the normal thing. Okay, so you should quickly examine for the skin and comment whether there are big looking nevi or abnormal looking nevi or not. Hemangioma are the tumor, benign tumor which develop from blood vessels. Scar, okay, scar, any wound or any incision given before, any prior surgery in the body before, scar will develop. Burrow, Burrow is the hallmark of scabies. This is a contagious disease which is caused by Sarcoptes scabi. It's a type of mite. Burrows are very commonly seen, especially around the fingers, and pigmentation of the hair. Usually in a healthy child, hair is black in color. It depends on the race actually. Okay, in Asian population, it is mainly black in color. In Western population, it's a slightly, different color. We all know that. But if a black colored hair is turning into white or gray colored hair, this is a feature of malnutrition. This usually occurs in kwashiorkor disease. So these are some of the points in skin and appendages. We can include so many other things, okay, but it is not possible to explain everything in one class. Now, what about head and neck examination? See here. Look for the size and shape of the head and measure the size. Palpate the anterior fontanelle or posterior fontanelle. If they are still open, okay, measure the size and comment whether they are open or closed. And quickly examine the tension of the anterior fontanelle. Now let me explain a little bit about this. A baby who is less than 18-month-old, okay, listen carefully. A baby who is less than 18-month-old, anterior fontanelle is still there. And if a baby is less than 6 weeks, okay, this posterior fontanelle is closed very early. In some of the book it is written probably for few months also, okay, but posterior fontanelle is not very important question for you. Anterior fontanelle is closed after 18 months of age. So if a small baby comes to us, we should feel it, okay. This is the point, and comment whether it is open or closed. Now let's comment on tension or pressure of anterior fontanelle. Now let me write two important conditions here, okay. In case of raised ICP, okay, raised ICP, if we feel anterior fontanelle, it is bulged, okay, there is bulging of anterior fontanelle. And in case of severe dehydration, the anterior fontanelle is sunken. It is sunken inside. Now see here. So this is a very important point. It is bulging because there is too much pressure inside the cranial cavity. And in dehydration, it is sunken inside. And in the normal state, it is at level. Okay, it is neither sunken nor bulging. Transillumination test in the head is positive in case of hydrocephalus. And everybody know what is hydrocephalus. Yes, what is hydrocephalus?
Accumulation of water in
If there
brain.
is blockage of CSF pathway, sir.
Increase of the cerebrum or head size due to accumulation of the fluid.
That's the
Okay,
blockage of CSF pathway to simple, sir.
exactly.
There is excessive accumulation of the CSF in the intracranial cavity, which is greater than 160 milliliter of water.
Okay, now see here, so many students are answering, okay. Now all of them, okay, all these answers I can accept actually, because the definition is a little bit wider. So hydrocephalus means excessive collection of CSF inside the ventricle and subarachnoid space of the brain. Excessive collection of CSF inside the ventricle and subarachnoid space of the brain. So if there is excessive collection, there will be increased pressure also, and most of the time in case of baby, okay, whose sutures are not fused, because of this the head becomes big in size as well. But in adult and after the fusion of suture, the head will not become bigger. Remember this, only the pressure is increased, only the volume of CSF is increased, but head doesn't become bigger in size. Now, examine for facial dysmorphism, means is there any abnormality in the face or not. One of the perfect example I can give is Down syndrome. Okay, Down syndrome, this is called mongoloid face. There's a typical features in the face. Examine for that. Maybe, who knows, it may be a syndromic baby. And examine for evidence of vitamin deficiency, like vitamin A deficiency. There will be feature in the eye. Okay, very dry eyes, which is called xerophthalmia. There may be bitter spot. There may be some problem in the cornea, which is known as keratomalacia. So all these things may be there in the eye. Examine for other vitamin deficiency like vitamin B, B1, B2, B3. Most of the findings are in the oral cavity or in the lips. So examine for that. Look for cataract. Now, cataract is opacification of the lens in the eye. Opacification of the lens inside the eye are called cataract. Okay, so a baby will lose the vision in case of cataract. Cataract are mainly developed by older people, but if your baby or a child develops cataract, it mainly shows there may be some metabolic disorder. Okay, some type of metabolic disorder or some torch group of infection, which are known as intrauterine infection. So look for the cataract. The pupil look whitish. Examine for ptosis, whether it is there or not. Now, ptosis is drooping of upper eyelid. Drooping of upper eyelid is called ptosis. Now remember, in upper eyelid, there is one important muscle, which is known as levator palpebrae superioris. Levator palpebrae superioris. Now, who can tell me which nerve is supplying that muscle? Which nerve? Anybody? Okay, probably, you know, oculomotor nerve. Third cranial nerve or oculomotor nerve. Okay, that is the correct answer. Third cranial nerve or oculomotor nerve. Here we are talking about ptosis right now, and ptosis is the drooping of upper eyelid, and that upper eyelid has levator palpebrae superioris muscle, which is supplied by third nerve. So any problem regarding the third nerve, there will be ptosis. Another important term is exophthalmos. Now, exophthalmos means the eyeball is protruding outside. It is bulged outside or outwards. It is a very important feature of hyperthyroidism or thyrotoxicosis. Okay, hyperthyroidism or thyrotoxicosis. Now, setting sun sign. Setting sun sign is an important feature of hydrocephalus, which we have already talked a little bit. Hydrocephalus, the setting sun sign is seen because the both eyeball will be pressed downwards constantly. And examine for parotid swelling. Now, can you tell me one disease where parotid swelling is seen? Which disease? Anybody? It is mumps. In a disease known as mumps, which is caused by mumps virus, parotid swelling is very commonly seen in children. So see there, a lot of information I'm providing. Okay, so please follow the video later on. Okay, everything is recorded there. I'll upload this in YouTube. All of you should follow that. Now let's go and examine mouth and throat. So what findings may be there? We have to examine for vitamin B deficiency inside the oral cavity or in the corner of the mouth. There may be different ulcers. Examine for lips and mucous membrane. Lips or mucous membrane. Okay, if it is a case of measles, there may be coplic spot, especially inside the mucous membrane of oral cavity, opposite the second molar tooth. Coplic spot is seen. This is very important feature of measles. Oral ulcerations are seen in so many different viral infection or nutritional deficiency. Examine for palate now, whether the palate is normal or high arch palate, or whether there is any defect in the palate, that is called cleft palate, or even perforation. These are the congenital disorders of the palate, which is called cleft palate. Cleft palate. Okay. 1 minute. Okay. Now another important point here. Okay. Another important point is examine for teeth and gum. Okay. Now count the number of teeth in that child and how they are arranged, as well as whether they are having cavities or not, and examine for gum. Sometimes gums are hypertrophied, okay, or they are not looking healthy. One of the important condition which causes hypertrophy or hyperplasia of the gum is one of the drug. Who can tell me that drug which can cause gum hyperplasia? Which drug is that?
Phenytoin, sir.
Phenytoin. Absolutely, it is phenytoin. Very good. Okay, and there is a disease known as scurvy where gums can bleed very easily. And one more, there is a condition known as leukemia, acute myeloid leukemia. In that condition also gums are hypertrophied and there may be easy bleeding from there. Okay, so phenytoin, scurvy, and AML, acute myeloid leukemia. In these conditions there is hyperplasia or hypertrophy of the gum. Now regarding the tongue, examine whether the tongue is coated or not. Coated tongue is a sign of illness, and whether the tongue is unusually big or not. Now there are few conditions where tongue looks very big. One of the example which always comes in our mind is hypothyroidism. Hypothyroidism. There is macroglossia, or tongue size is really big. Okay. Examine for tonsils and pharynx with the help of tongue spatula, and examine whether tonsils are enlarged, whether they are red in appearance, or whether they are pus point on the surface. Now these are seen in different diseases, bacterial or viral. Examine for the ears. For the ear discharge, any unusual wax collection, inflammation, or perforation of the eardrum. These are all features of different ear disorders. So in one sentence, examine mouth and throat as well as ear very properly. Let's move on. Now another point here is examine neck and examine for evidence of deficient state. Now neck is examined for any swelling, any low hairline, or waving of the neck. Now if you remember, low hairline and waving of the neck is seen in one common condition which is seen in girl. Okay, what is that condition? That is a type of syndrome which is seen in girl.
Down syndrome.
Which syndrome?
Klinefelter syndrome. Klinefelter syndrome.
Klinefelter, sir.
It is Turner.
Klein-
It is Turner
Turner.
syndrome. Turner. Okay, not Klinefelter. Klinefelter is seen in boys. Turner syndrome is seen in girls. Okay, so let me write the name here. It's Turner. Turner syndrome. Remember, there is low posterior hairline and there is waving of the neck. Now JBP is always examined, especially if there is a feature of heart failure. Examine for thyroid gland, whether it is swollen or not. Examine for lymph nodes, palpate the lymph nodes on the neck, and position of the trachea is always look for, especially in case of respiratory diseases. Okay, so these are the examination of the neck. Evidence of deficiency state, examine for signs of dehydration. This is a special class for you in pediatrics. We'll talk in detail there. For example, If a baby is less than 18 months, we look for anterior fontanelle, which is depressed in severe dehydration. The oral cavity is dry, okay? The skin turgor is reduced, isn't it? There is lack of the tear. The baby is thirsty. The baby is tachycardic. So many features of dehydration are there. Look for vitamin A and B complex sign, already talked about, and look for mineral deficiency features. Iron is a type of mineral. Calcium is a type of mineral. So if they are deficient, different things are there. This is the way a physical examination can be quickly done. There are so many other features still. Now examine for bones and joints. Now here, examine for deformity of the chest, swelling of the end of the bone, inflammation of the joint, if there are club foot present or not, is there any bow leg or knock knee or any edema of the limbs. Now these may be new terms for you, okay? So let me explain them. Now see here, deformity of the chest, okay? There are certain important terms, okay? There are the important term. Let me explain it, okay? Wait, explain it here. Regarding the, wait 1 minute. Okay, regarding the chest deformity, there are certain important medical terms which are known as pectus carinatum, okay, pectus carinatum or pectus excavatum. Now, pectus carinatum means the sternum bone is protruded forward, and pectus excavatum means it is, okay, going deeper inside. This is a type of chest deformity. Easily you can give this example. Another example you can give is scoliosis or kyphosis if it occurs on the vertebra which are present on the chest. This also can be another example. Now swelling of the end of bone is commonly seen in a condition, okay, which is caused by vitamin D deficiency in children. Which disease is that?
Rickets.
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 Okay,
Rickets.
absolutely, it is rickets. So swelling of end of the bone is seen in rickets. Joint inflammation, so many examples we can give, like rheumatic fever, rheumatoid arthritis, septic arthritis, or even the gout, different joint diseases. Club foot can be seen congenitally. A baby may be born with club foot, okay, this is rotation inward of the foot. Bow leg and knock knee, these again can be seen in rickets. Bow leg and knock knee. Knock knee means the knees are coming closer to each other and the legs are going away from each other. This is known as knock knee. And bow leg, okay, bow leg means the leg are coming towards the midline now and knees are going away. So exactly opposite to each other. So both of them can be seen in rickets. Edema of the limb is a feature of heart failure or cirrhosis of the liver or hypoproteinemia, those type of conditions. Now examine for spine for the curvature. Is there any scoliosis or kyphosis present or not? Examine for swelling and tenderness. Examine for range of movement and deformity. Quickly, okay, we should press each and every spine and look for these important features. And at the end, if the patient is adolescent, okay, if the patient is adolescent, then what should I do? I should examine for sexual maturity rating. And that is just to make sure whether the sexual organs or secondary sexual characteristics are already developed according to the age or not. This is called sexual maturity rating. We'll talk about that sometimes later. Now, these all are parts of our general examination along with vital sign. Now, another important part of the examination is systemic exam. So in today's class, we cannot talk about everything, but just know in pediatrics, as far as possible, the systemic examinations are done under 4 headings: inspection, palpation, percussion, and auscultation. Percussion may not be possible everywhere. Auscultation also may not be possible everywhere. For example, you are doing examination of central nervous system. What is the role of auscultation there, isn't it? But in cardiovascular system and respiratory system, auscultation plays a big role. Even in abdominal exam, auscultation should be done. So these are the meaning. Wherever it is possible, we go for this examination. Now, after this, okay, listen carefully. After this, we collect all the evidences now. From the history taking, we have collected few. From the physical examination, we have collected few. Now, let's combine these two together and make one provisional diagnosis. This is called provisional diagnosis. Then you should order some investigation or test and wait for the result. When the report or result come, then you combine everything together and make your final diagnosis. So this is the way a diagnosis is synthesized in clinical medicine or pediatrics. Now, at the end, okay, at the end, these are the important question a pediatric doctor or pediatrician should ask to himself or herself. What is my working diagnosis? Have I made any working diagnosis or not? You have to make one after the examination of the child. Otherwise, you have to go back and take the history and do the examination again. Can historical and clinical findings be related with pathophysiology of the diagnosis or not? Okay, so you have to give reason or explanation how that historical point or physical examination points are matching with my pathophysiology. Did all the patient's problem relate with the diagnosis or not? Sometime, okay, the patient party complain about 5 or 6 different problems. As far as possible, all those problems or symptoms should be, okay, should be brought under one diagnosis. That's what we do. Sometimes it may not be possible, but that is the principle. Can I make a list of differential diagnosis or not? Usually a good student will make 2 or 3 differential diagnoses, because if you make only one diagnosis and if that is a wrong diagnosis, you are nowhere. Okay, but if you have made 2 to 3 diagnoses and later on rule out one by one, that is always a good option. Can I list investigation that will help to confirm the diagnosis or not? That will be asked to you after you complete history taking or physical examination. Your senior will definitely ask you what test you like to do in this case, and you should list them. Maybe complete blood count, maybe blood culture, maybe chest x-ray, maybe CT scan. You should take those investigation names. Can I write a prescription for the diagnosis or not? Now, after you go for the internship, and after that, you can write your own prescription. During internship, you have to write your consultant name there, but after you complete it, you can write prescription on your own. So writing prescription is an art. You should learn this in medical school. Did I explain the parent about the child's illness or not? That is the parent's right. They want to know what has happened to their child, and as a doctor, I must be able to explain that to them, everything about the illness. So I should have a good knowledge about the disease. Did the parent understand what I have explained? So remember this, when you are talking with the parent, don't use medical terms that much. Okay, change that, the meaning of medical term, into patient's own language and then explain. Otherwise, they won't understand anything. And at last, did parent leave the room with a smile in face or not? This is for your own purpose, isn't it? If you make them happy, they'll come back again. Okay, and you would be satisfied from deep inside. Yes, I have done a good job today. I have made those parents happy.